picture of the kit that you're going to be using for your central line dressing change assignment. This is the kit that is intact, that has not been opened yet. You can read all of the contents are listed on the front there. And then this is what the kit looks like when it's open. The pieces that you're going to need are obviously going to be your sterile gloves. The mask is not, it's on the inside of the kit, it's not on the outside of the kit, so you'll have to pull that out sterilely. You'll have to pull your sterile gloves out without touching anything else in the kit, and you'll be using the ChloroPrep stick as well as the transparent dressing. Also, there's a little sticker on here for date and time, type of catheter, and all that. The other things in the kit you're not going to use for your checkoff, but might come in handy when you're actually doing a sterile dressing change, sterile central line dressing change. These alcohol wipes are really good for maybe getting some dried blood off, but we're not going to go over that for the checkoff portion. So this is the equipment that you're going to need. So we're going to go over to the bedside. I have the patient all prepped, and then I'm going to show you how to open the kit and go through the procedure of changing the dressing. All right, so Kylie, zoom in on the dressing. The transparent dressing you'll see has a sticker on it. It has the date and time, initials that it was last changed, and it looks like it's time for a dressing change. I have my patient positioned appropriately, and I'm gonna go grab some clean gloves to take the dressing off. So with your clean gloves, you're going to remove your dressing from the site. Okay, so I'm just going to start at the edge and peel it up. I'm observing the insertion site to see if there is any redness, drainage, if the patient is describing any tenderness or anything like that. And I'm going to pull this up and away toward the patient's face. What I don't want to do is pull it in this direction because I could potentially dislodge the line. You're welcome to peel this under, being careful not to touch the insertion site. You can pull that dressing up. Make it work however it works for you. Just be careful not to get your hands underneath there. And then we're just going to lift this off and up and away. Okay, so now I can observe the insertion site. I'm going to remove my gloves and sanitize my hands. And then I'm going to start the process of opening my kit. This is your central line dressing kit tray. Flip it over and open it. This is not sterile on the outside, so you can pick this up and remove this from your kit. If you don't need this, you can just discard it. So I'm just going to put it off to the side here in the trash. This is a really nice little kit. It mimics the Foley as far as the wrapping goes. So you're going to pull this away from you. There's your mask. I've already put a mask on, so I don't need to put this one on, so I'm just going to set this aside. But the nice thing about it, it has the mask here, and you don't have to go into the sterile kit for it. So you can put your mask on at this point. Make sure that you are putting your mask on and then sanitizing your hands again, because you don't want to touch your hair and then go into your kit. So we're going to open side to side. You can see these are a little stiff, so you kind of have to stretch the sides a little bit. Maintaining that 1-inch border is your sterile border. Just putting a little bit of extra, pulling on these a little bit extra to kind of just flatten them out, okay? Now I'm going to go in and I'm going to get my gloves out of here without touching anything else on the kit. Coming to the side, I'm going to open up my sterile gloves off to the side. This table could actually be a little higher for me, but I like to crinkle up those gloves a little bit. Open the top, open the bottom. And if I touch here in this area, I just have to be aware that that's not sterile anymore. Okay. Open it like a book. And then I'm going to go to the side a little bit because I don't want to touch that Purell bottle. I think they're looking pretty good. So we're going in, reach underneath that cuff, lift it up and away, and we'll wiggle that thumb in there first. Done. Do not adjust your cuffs. And I'm going to go in. I'm sterile to sterile, so I'm going to get those fingers underneath this cuff. And I'm going to have it hanging. This thumb is up on my right hand. slide my fingers in, try to get that thumb first. It usually helps me to guide those hands in, and then I'm all set. Now I'm sterile to sterile. I can touch anything in this kit as long as I'm respecting that 1-inch border. And as I said, the only things I really need in this are gonna be my ChloraPrep. I'm gonna put that off to the side. I don't need this. This isn't gonna be put on sterilely because it's gonna be put on after I do the dressing, so I don't need that as well. So that all can be off to the side. And then I have my transparent dressing. Actually, I'll put this off to the side as well. Don't need a lot of that stuff. Okay, so now I've done my inspection of the site. Hands are above the waist, maintaining my sterile field. If this were a real person, I would crack this. Fluid's gonna come down. You only need to crack it one time. I like these sticks because they're long and it keeps your hand away from the insertion site. Placing it on the patient, and you're literally just gonna scrub back and forth. I'm going over the tape, but there would be some sort of a securement device on here. Back and forth with friction. And I need to do that for about 30 seconds. Keeping this in contact with the patient's skin, scrubbing back and forth. And with the ChloraPrep, you can just go all over the place and clean. It's the friction and the ingredients in the ChloraPrep that do the cleansing. When I'm done, this goes away. I don't want to go back over that sterile field, so I'm just going to drop it there or drop it in the trash can. I'm going to allow that to dry. The directions, I believe, say 1 minute, but we certainly want to let it dry as long as it needs to. We don't want to put the dressing on when it's wet. So just like a Band-Aid, literally you're going to peel this in half. Take this, place it over the insertion site. You want the insertion site about halfway on that dressing, and then peel. Push that down so that everything is in contact with the skin. Careful not to push too hard right there. Okay, there's a little bit of and your sterile portion is over at this point. There's a little bit of crack. There's a crack here in the dressing. I'm gonna follow my finger around so that the dressing does not lift up off of the skin. Keeping that in contact with the skin because it needs to be an occlusive dressing. I'm gonna try to keep that sticker intact because when I'm done, I wanna make sure that I put my date and time and my initials on here so that I know when this was changed the last time.